Law Medical. Today I'm going to be talking about some awesome procedures that you can do starting in your 20s and 30s. I'm here with my patient Morgan, and she is interested in Botox. So typically how I start off a consultation is by asking the patient what bothers them. So Morgan, you want to tell us what bothers you?
Yes, so I have these lines in my forehead whenever I raise my brows up, and then kind of on the side when I smile, I feel like there's a ton of lines. It looks like an accordion.
Okay, so these are lines created by muscle movement, and they're expression lines which Botox can treat. So what I would treat Morgan with is we would do just a little bit of Botox in her forehead, and we would do a little around her eyes to treat her crow's feet, so that when she smiles it kind of smooths out the lines and brightens her appearance. So a lot of people are going to say that Morgan is too young for Botox just because she's in her mid-20s. But Botox is preventative, so by doing just a little every couple months, it's going to smooth out the lines and keep them from getting deeper over time, and it'll just brighten out her overall appearance. So Botox takes a couple of days to kick in. It's typically between 5 and 7. So we'll do it today. We'll see how long it takes Morgan's to kick in, and then it should last around 3 to 4 months. So she'll start to notice it wearing off around 3 to 4 months, and then she would come back and get it again to keep it up over time. And some other areas that we could treat with Botox, maybe not today, but kind of down the road whenever we start to notice some lines at wrist, or whenever an area starts to bother her, would be in between her brows. As you age, a lot of people start to get the 11 lines right here. So that's another area. You can actually do a tiny bit under the eye for when you smile. Some people get a little pooch. It'll help smooth that out. Some other areas would be the masseter muscle that helps with facial slimming, or if you grind your teeth or have TMJ. Okay, so we have Rachel here, and she's in her late 20s, so we're going to talk about a couple areas that bother her and then whether we want to address it with Botox or filler. So Rachel, why don't you start off by telling me what bothers you and what you're interested in?
So really I just have a very thin upper lip, so that when I smile it kind of disappears. So I'm just looking for something there to kind of bring out a natural look. I don't want, like those big lips that you see places, but I'd want a more natural looking lip, and then I have the 11s between my brows and forehead lines as well.
Okay, awesome. So we just talked about Botox with Morgan, so we would do the same with Rachel. She mentioned her forehead lines and her 11 lines. So we could just do a little splash of Botox there, keep it up every couple months. It's going to smooth out the lines and brighten her appearance. So now we're going to address Rachel's top lip. So since she doesn't want a ton of volume, we could start with a lip flip using Botox. And what this does is it's just a couple little pricks on your top lip, but it relaxes the muscle and it'll help show your top lip more. It will not add volume or create, large plump lips like filler does. So we would probably just start with a lip flip, do a little Botox, see how she likes it, and then maybe down the road progress to filler. And using filler, all we're really doing, in your 20s and 30s, we're not necessarily correcting or adding volume, but we're just enhancing your natural features. And some other areas that you can treat in your 20s and 30s with filler would be your cheeks. So we could add a little filler out in your cheeks just to kind of create that nice contour and cheekbone. Another place several patients like to treat is the jawline. It's becoming a little bit more popular right now, just defining the jaw, and it helps with a little bit of facial slimming. Another really popular area is tear troughs. So as you age, you start to get a little depression in here, and we can add just a little bit of filler to kind of smooth and brighten the appearance under your eyes. If you're interested in any of these procedures or treatments, I would love to see you for a consultation, so you can head on to our website or give us a call.